Foley catheter is a thin, flexible tube that drains urine from the bladder into a collection bag. It's also known as an indwelling urinary catheter (IDC). A Foley catheter is used when someone can't urinate on their own or for other medical reasons. Some uses include draining the bladder before, during, or after surgery, delivering medicine into the bladder, such as during chemotherapy, treating urinary incontinence, monitoring urine output in critically ill or injured people, collecting a urine sample for diagnostic purposes. Size. Foley catheters are sized in French units FR. The standard size for most commercially available kits is 14 or 16 FR. Care. You should clean the catheter daily and change the drainage bags twice a day. You should also wash the urinary opening at least twice a day. Balloon. A small balloon filled with sterile water holds the catheter in place in the bladder. You should deflate the balloon before removing the catheter. Bag. The collection bag should be lower than the patient's bladder to allow urine to flow in the correct direction. An indwelling catheter is also known as a Foley catheter, a thin, flexible tube that's inserted into the bladder through the urethra or suprapubically. A water-filled balloon keeps the catheter in place. Purpose. Used to drain the bladder continuously for conditions like urinary incontinence or urinary retention. How it's used. A nurse inserts the catheter and connects it to a drainage bag that's strapped to the leg or hangs from a bed or stand. The bag is emptied when it's full. How long it's used. It's recommended for short-term use, usually less than 30 days. A doctor or nurse should replace it every 3 months. Materials. Indwelling catheters are available in different materials, such as latex and silicone. Latex is soft and flexible, but should be coated to prevent tissue irritation. Silicone is tissue-friendly and hypoallergenic. Foley catheter is a medical device that helps drain urine from your bladder. Healthcare providers use Foley catheters if you have a condition that makes it difficult or impossible to pee. You may also need a Foley catheter while your body heals after surgery. A provider can teach you how to insert and clean a Foley catheter. A Foley catheter travels through your urethra into your bladder. Once it reaches your urethra, the balloon fills with sterile water to keep the catheter in your bladder. A urinary catheter is a tube that healthcare providers use to quickly drain your bladder. Usually, if something is blocking your urinary tract, you shouldn't use a urinary catheter over a long period. A Foley catheter has a small balloon at one end to hold it in place in your bladder. You can use Foley catheters over a long period. If you have difficulty peeing or can't pee, you may need a Foley catheter to empty your bladder. It can feel strange or surreal to know you're using it, or that you're carrying your pee in a bag outside your body. Always priority health and safety.